Plano health insurance may undergo major reform as experts advocate for a market-based system using risk equalization to boost consumer choice, affordability, and transparency, similar to how car insurance works. Plano health insurance often lacks the freedom and efficiency seen in other industries, particularly when compared to how car insurance operates. In car insurance, the consumer holds power, able to compare providers, evaluate service quality, and switch to better options with ease. That competitive landscape encourages innovation, drives costs down, and enhances service quality. Unfortunately, the same cannot be said for most health plans. Access is usually tied to employment, options are limited, and the process lacks transparency. Costs often remain hidden until after services are rendered, and losing a job can mean losing access to essential care altogether. The structure favors providers and employers more than the individual, reducing flexibility and responsiveness to changing life situations. More information can be found at insuranceforce.dallas.com/health insurance Plano. The complexity grows further when families are covered through multiple disconnected plans. Some may have coverage through employer-based systems, others through government-run options, and children through separate public health programs. This patchwork creates confusion and often leads to gaps in care or sudden loss of eligibility when incomes change. The system reacts harshly to progress, creating barriers instead of bridges to better coverage. Health insurance Plano is dominated by a few key players that rarely face real competition, allowing them to increase premiums and reduce benefits without consequence. Meanwhile, consumers must navigate this landscape with little guidance, minimal support, and no assurance that the plans available meet their actual health needs or financial circumstances. To create a more balanced and responsive system, some regions are exploring models that introduce a risk equalization approach. This method allows private insurers to operate in a competitive environment while compensating them fairly for covering individuals with greater healthcare needs. Consumers simply focus on selecting the most suitable plan, while back-end adjustments ensure fairness across providers. A structured system like this encourages competition without penalizing vulnerable populations. When paired with subsidies for lower-income families, it offers both affordability and choice. Guidance from a qualified Plano health insurance agent becomes essential in helping individuals and families choose wisely in such a system, bringing health coverage closer to the consumer-centered model long seen in car insurance. Insurance for Dallas, I4D, helps insure all of Texas, Oklahoma, Arkansas, Arizona, Louisiana, New Mexico, Alabama, Virginia, and Florida. Insurance. Dallas provides consumers with detailed information on health insurance with the ability to purchase health insurance online. Insurance. Dallas provides a full spectrum of health, dental, vision, life, and ancillary insurance products, providing a diverse selection of price and benefit options complemented by personal customer service. Available via phone, email, or fax. Insurance. Dallas answers consumer questions throughout the purchasing process and during the utilization of its health insurance policies.